Gynecomastia is a problem that some males can have with enlarged chest. Now, what happens with gynecomastia? There's some breast tissue or extra breast tissue around the nipple and sometimes into the breast of the chest. There are several causes for gynecomastia. Some of them are just idiopathic and you never know a cause. The first thing you have to do when you're thinking about gynecomastia is you need to rule out a hormonal cause of the gynecomastia. Once that's done and there's no cause, there's no hormonal problem, then the surgery for gynecomastia can be done. Two things that are available to treat the gynecomastia. One is liposuction and the other is surgical excision of the tissue. A lot of times it may be a combination of the two. When I approach the gynecomastia, I will always try to see about liposuction first to see if we're removing the tissue to avoid the scars of surgical excision. And sometimes, even if you have to have a surgical incision, you can make a smaller incision by doing liposuction first, removing some of the tissue, and then finishing it off with a surgical excision, where you can, take a long scar and make it a short scar instead by doing the liposuction first. So that's really the goal, that what you're trying to do with gynecomastia surgery is taking away that, restoring the shape of the male breast and removing that tissue. The things that are complications you have to consider with this surgery is you have to consider scar problems, keloid formation, dark scars, infection, hematoma, and a wound separation. Those are the things that you have to consider in things with the gynecomastia surgery. But that's generally the idea of the gynecomastia surgery. Our two weapons against it are the liposuction and the surgical excision. Most people, it's not a terribly painful procedure. The swelling will go down if the liposuction is being used. If there's a lot of redundant skin, that skin may shrink over the next several months to actually look its best. Most times you can get away with just the liposuction by itself and not leave a scar, a large scar and things like that when you're treating the gynecomastia. Sometimes gynecomastia is done in combination with liposuction of the abdomen, and when this is done, a lot of times you can enhance the six-pack in the men and get a better shape on the abdomen and a more muscular look of the abdomen. Thank you.